David Katz on my left here, and he's the founder and the president of the True Health Initiative, and he's recognised all around the world for determine why some people are happier than others, and a great case study we'll be talking about is Denmark itself, so we'll love to pick your brain on that one, Mike. And then we have Dr. Hanan Selim, who is known as the pharmacist of the future. She's part of the leading experts in preventative and behavioural health care. Dr. Hanan's system, is the creator of the system, the Healology system, which basically looks to heal crises through communication between the mind and the body. So that is an introduction. We might kick it off though and go right back to the start, David, just to understand the heart of all of this and why governments should actually care about whether their societies are happy or whether they are mentally and physically healthy.
Well, first of all, Leanne, it's a pleasure to be with you, the other panelists, with all of you. It's an honor to be here. My work is focused on health, and I think it would be perfectly reasonable to ask the question, what is health for? Health isn't the prize. The reason we care about health is because healthy people have more fun. So much of what we try to do individually and collectively is really all oriented toward quality of life, toward advancing the human condition. If governments don't care about that, governments have no reason to exist. Governments ultimately need to reflect the collective aspirations of people, and people aspire to having good lives.
Is there a direct link between health and happiness? I mean, do they kind of go
Absolutely, there's a direct link, and it goes in both directions. So it's absolutely true that other things being equal, healthy people have more fun, and if you have the vitality to do the things you love to do, to be productive, to pursue your fulfillment, you're much more likely to be happy. If you are happy and content, you're much more capable of making investments in your own health. And frankly, happiness itself protects the body. It reduces inflammation, it helps balance hormones. They're bidirectional, but they are quite separate. You can be healthy but not happy. You can be happy despite being unhealthy. So they support one another, but they can be independent. In terms of government playing a role, I think one of the critical messages I'd like to leave behind here as we think about the balance of collective responsibility and individual responsibility is that the choices people make are subordinate to the choices people have. And government plays a crucial role in the choices people have every day and can make it easier for people to make the choices and pursue the choices that lead to both health and happiness.
Mike, in terms of how you actually measure happiness, because that's what you're all about at the Happiness Institute, you think of something like the economy, for example, it's quite easy to look at. You've got GDP, you've got growth, unemployment, interest rates. I just wonder how you can actually measure happiness. Is that quite a challenge for governments?
It's a challenge, but I think people sometimes mistake difficult with impossible. And equally difficult is it to measure an economy. How well is the UAE economy doing? Well, we understand that by breaking it down and look at the different components that you describe. So that's also what we need to do with happiness and well-being, breaking it down and then looking at different components. How happy David feels is about what kind of emotions do we feel here and now. Do we feel angry, frustrated, worried, sad, lonely, happy? But another perspective is how happy does David feel with his life overall? How satisfied is David? And to me, the only one that can tell us that is David, and putting that at the core of what we're trying to understand is the new development in understanding the progress that different countries are making. And I very much agree with what David said so far, and also I'm encouraged with what I see governments around the world doing these years, because there is a growing understanding that the way we have been measuring progress in terms of GDP per capita is insufficient. So we see more countries starting to embrace these softer measures of well-being, of happiness, And obviously we are in one of the pioneering countries. The UAE have a Minister of State for Happiness and Well-being. I hope more countries will take lead in that, and we are seeing more countries starting to measure progress in terms of well-being. You have the UK saying that, well, one thing is whether we get richer, equally important is whether our people are getting happier. Famously, we've had Sultan, who was navigated with gross national happiness for the past 40 years, and every political decision is based on not is this going to improve the economy, but is this going to improve quality of life for our people. Last fall, you had New Zealand's government saying, well, every political decision or every policy proposal should come with a cost-effective proposal in terms of how is this going to impact. So we see more countries embracing these softer measures, and I think it's because a lot of people around the world have this sensation or this feeling that we have gotten richer as countries without getting happier. And examples of those were, countries, Tunisia, Egypt. If you looked at the period leading up to the Arab Spring in 2011, if you looked at the GDP levels per capita, things looked like they were going fine. Egypt, 23% increased GDP per capita in that 5-year period. In that same time, the share of people that felt that their lives were thriving drops to a third. So OECD concludes, well, well-being is a better way to capture what's actually going on within people. So that's why we see also, I think, a move towards these measures.
Hanan, health, sorry, David.
Leanne, if I may just to react, first of all, I'm very happy to be on the panel with both of you. So I'm very happy right now. But, I think the economists, I was going to say, from my perspective in public health, they've been in charge for too long, and they've talked us into certain things. Like, for example, the idea that economies have to grow infinitely, right? I mean, it's always about growth, but the growth comes at the expense of using things up. And there were discussions this morning here about sustainability. And so the idea that even if we're going to look at economic measures, we may need to change those measures. How within a certain size economy do we optimize productivity and happiness and make the best use of resources? But this idea of infinite growth, which is what the economists have been selling us for a long time, if your economy isn't bigger this quarter than last quarter, you're failing somehow. But we don't have infinite resources.
Yes.
And so, I think there's really a mismatch between what we're doing to the planet and the measures of economic success, and that's making me unhappy.
And I think, so just one short thing to add to that, I think the key question for countries, communities, also people to ask nowadays is how do we convert wealth into well-being?
Yes.
Which investment should we make to bring quality of life to people?
Yes, exactly. Hanan, education is such a huge part of this as well. You look at obviously health and you can separate it into two areas. You have physical health, so your diet and your lifestyle. You have mental health, which maybe is a little bit more difficult to actually assess. But how should a government really look to educate their society to promote that health and their happiness? In terms of education.
Well, a lot of people think that physical health is the cornerstone to mental health, but I really believe it's the opposite. I think it starts from within ourselves, because the government will give a lot of information and skills and the structure, but unless they're willing, having the attitude to absorb that and take it on a personal, individual level to make those changes, that it will not work. So I think we have to start on individual level to see what the person's mindset is at and be able to give them the strategies and understanding and ideas. I mean, awareness of the root causes behind a lot of the situations like lifestyle diseases that are caused epidemic now, like obesity, cancer, diabetes, and so forth. The World Health Organization is having such a hard time with it because it also comes back to the individual. You could give them the right medication and the protocols that the textbook calls for, but the implementation goes back to the individual. And the same thing with the change in the mental health as well as the physical health towards productivity and influencing the economy as well, as the gentleman here just pointed out.
Chronic diseases, heart disease, cancer, stroke, diabetes, dementia. again, I don't think health is the prize. Physical health is not the prize. The prize is having the life you want to have. Lots of years in life, lots of life in years. That's the prize. So I completely agree. You know, essentially, mental health is the ultimate measure. But the other thing is our mental well-being is the source of our strength. It's the source of our resolve. It's the source of our ability to take on new challenges. If you don't exercise and you want to start, you're drawing on your reserve of mental energy to get started. If you don't eat well and you want to commit to eating better, you're drawing on that reserve of mental energy to make that change. If you smoke, and you should all quit smoking if you smoke, to make that shift, you need to draw on a reserve of mental energy. However, if you're physically unwell, it drains your mental energy. You have pain, you don't sleep well. Every day, you're fighting against that weight you have to carry. So I would simply say they're mutually supportive. Either one could undermine the other. We really do need both.
I come from the idea that behind every condition, right? Well, let's take diabetes, for example. Diabetes actually starts at pre-diabetes, 10 years before diagnosis. Cancer, Alzheimer's disease, and all these diseases start away 15 to 20 years before diagnosis, because there's an event or a story, if you will, that happened in a mental stage that kind of triggered those chemicals. I call it the mind-brain-organ conversation. There's an actual conversation of chemical exchange and going on in the body that starts from the mind.
Mike, there is still very much a stigma around mental health, and that's very much a challenge for governments to try and address. How do they educate their society to change their mindsets and to kind of reduce that stigma around mental illness?
It's a super good question. And it's interesting when you look, for example, at statistics around consumption of antidepressants. And you'll see countries like South Korea, Hungary, have really low consumption of antidepressants. Now, you'll see Scandinavian countries, which are often quoted as some of the happiest countries in the world, they have quite high consumption of antidepressants. So people see that as a paradox. The thing is, if you look at suicide numbers, you'll see that Hungary, South Korea, with the low levels of consumption of antidepressants, also have some of the highest suicide rates. So South Korea has the highest suicide rate in OECD. So the thing is, people in South Korea are depressed. They're just not getting treatment because there's a huge social stigma around mental illness. I've spoken to a lot of people from South Korea because they're really struggling with that same challenge we talked about before. They've had this tremendous growth over the past 40, 60 years, gone from one of the poorest countries to one of the richest countries, but have failed to convert that into well-being. And it's the country we get most visits from at the Happiness Research Institute, in part because they want to understand how can reduce the social stigma around mental illness. I've had conversations with people who said, unfortunately lost one of their parents to suicide. But in the family, the story is that the woman died in a car accident.
Social media to validate information. When I started my medical career, roughly 30 years ago, people would come to the doctor and not know much and say, "Doctor, tell me." These 30 years later, everybody's online, they come to the doctor, they already know everything, and most of it's wrong. It's a much bigger job to try and first empty the vessel so you can fill it. Government can help. So I think one of the things you could do here in Sharjah, in the UAE, is to help curate information about diet, information about the importance of physical activity, information about smoking, and essentially help guide people to we care about our citizens here. We have the same internet access you do. We can do a Google search too, but we've had experts do it to help point out, here are the sites you can really trust if you're interested in information about diet or what will make you healthy. I think that's a crucial role because misinformation is one of the great toxins of the modern age.
Yes. Obviously, governments can do, a certain amount, but it also comes back to the